Good morning, everyone. We'll start today's briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Coronavirus Task Force and Chairman of the Metro Board of Health. Lindsay Smith, Director of Vote Early TN, will also join us, as will Dr. William Schaffner, Professor of Medicine and Infectious Diseases in the Department of Health Policy with Vanderbilt University Medical Center. Dr. Schaffner will be joining us by WebEx. Also here to help answer your questions is Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Let's get started with the latest information about COVID-19. We continue to see our numbers moving in the wrong direction. This morning, for the first time, 3 of our key metrics are red and 2 others are yellow. New cases are rising. Look at this graph, and it shows our 14-day rolling average. Back in June, we saw our cases begin to increase rapidly. By July, we were averaging 400 new cases per day, and that's when we mandated masks and put limits on large gatherings, and it worked. By September, our new cases dropped to around 100, but now it's going back up, and we are averaging 175 new cases a day. Health experts have warned that we need to double down on masks and social distancing to make sure that we stop this surge in its tracks. Wearing a mask and keeping your distance, even when you're around people you know, will help protect friends and family. It will save lives, and it will protect our economy so we can move forward. In Nashville, we've demonstrated that masks work. We flattened the curve in July, August, and September, and we can do it again. This week, Nashville's hospital system sounded the alarm because of an increase in COVID admissions. Ascension St. Thomas, TriStar Health, Meharry Medical College, and Vanderbilt Health have issued a joint statement expressing their concern that a major surge in cases could threaten their ability to serve patients across Middle Tennessee. We must all work together now, as we did in July, to prevent COVID from overwhelming our hospitals. Right now, Tennessee has a record number of COVID hospitalizations, and Nashville's count is rapidly approaching our late July peak. But there is a way forward, and everyone can help. We can protect our families and friends, our hospitals, and our economy, and we know what to do. We know what works. Wear a mask, keep your distance, avoid large crowds. As a state and as a region, we are not using the best tool that we have, masks. Wearing a mask protects jobs and allows our schools to reopen. Masks work, but we've got to wear them. Business and government requiring masks makes a difference. Williamson County today announced they will reinstate their mask mandate beginning Saturday, and I want to recognize county and city mayors there for using our best tool in the fight against COVID. What happens at your backyard grill out, your friend's wedding, or your child's birthday party affects our city's health, economy, and hospital capacity. So far, 292 Nashvillians have died from COVID-19, including a 23-year-old woman who passed away this week. We are all in this together. You can save a life by wearing a mask, and please do your part to keep Nashville safe. Businesses know that, and they protect their customers and employees. And we know customers and employees are loyal to companies that make them feel safe. And that's why all major retailers and restaurant chains continue to mandate masks in order to implement best national practice. So even if your county doesn't require masks, we need everyone to wear one. Look, we are all tired of this virus, but we've got to stay with it. We must protect our people and our economy. We must take care of our families, our neighbors, and our businesses. And that's how we beat this virus. Now, Dr. William Schaffner from Vanderbilt University Medical Center is here to tell us the best ways we can continue to fight the virus. And tonight, the eyes of the nation will be on Nashville and on Belmont University. Not too far from here, the final presidential debate will take the stage tonight at 8. And thanks to Dr. Bob Fisher and the team at Belmont, the organizers and the sponsors, for their hard work over the past year. The pandemic has presented Belmont with some major challenges, and they've done a terrific job of overcoming them. Thank you also to the Metro Nashville employees who've been working with this team every step of the way. When the nation tunes in tonight, it will see Nashville's resilience, its flexibility, its hospitality, and its spirit. As the 2020 election process continues with the debate tonight here in Davidson County, we continue with early voting from now through October the 29th. Lindsay Smith from Vote Early TN is with us today to share more about early voting. And finally, our community hero of the week is Kent Foreman. Kent is a former information officer at the General Insurance Company and for Gaylord Entertainment. And in retirement, he has been volunteering at McGavock High School, from distributing food boxes to families to transporting materials to area schools. Kent has been there for MNPS to do anything he's been asked. Thank you, Kent. And thanks to all those volunteering their time to help MNPS achieve its mission to serve our students in these trying times. And now I'd like to turn it over to Dr. Alex Jahangir, Chairman of the Metro Nashville Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here are the latest on coronavirus in Davidson County. Today, we have a total of 32,559 cases. That is an increase of 249 cases from yesterday. The active cases today are 1,920. To put this in perspective, just 2 weeks ago, we were just over 1,100. Our rolling 14-day average of new cases today is 175. Just 2 weeks ago, we were at 104. New cases per 100,000 today, 28.2. And again, just 2 weeks ago, we were at 15. So all this is telling us that obviously our transmission is getting higher. And our transmission rate now is at 1.22, the highest this number has been since July 3rd. Now, Middle Tennessee hospitals are sounding the warning. Our hospital capacity in all of Middle Tennessee today is 13%. If you look just at the 9 hospitals within Nashville, that number drops to 5%, just 5%. And ICU bed capacity in both Middle and Nashville are 10%. 7-day positivity today is 6.1%. Again, just 2 weeks ago, we were hitting 3.6%. And it's not because testing is going down. In fact, our testing continues to increase, with averaging about 4,000 tests a day. All said, since the beginning of this pandemic, we have now tested 480,000 individuals here in Middle Tennessee. Now, mortality in Nashville is also at 292 people have died. Now, the overall mortality rate is 0.82%, but I think what people need to pay attention to is that once you are age 65 years or higher, your mortality rate does jump up tremendously. In fact, those individuals between 65 and 74 years of age have a mortality rate of 5%. Individuals who are 75 years old to 84 years of age have a mortality rate of 13%. And if you are 85 years or older and you get this virus, you have a 15% chance of dying. This is a deadly disease. Now, regarding hospitalizations, in August and September, we had leveled off at around 100 cases in the entire city of Nashville. And this was manageable by hospitals. But this started changing at the beginning of this month, when we started seeing more and more patients coming from all over to Nashville hospitals. Today, 184 patients are in Nashville area hospitals. On Tuesdays, the area hospitals, in an unprecedented move, released a joint statement expressing the concerns about this increased hospitalization rate. Over the last 2 weeks, in our Middle Tennessee area, so the 13 counties that these hospital systems serve, we've seen an increase in cases of 50%. We've seen an increase in hospitalizations of 40%. And what we're seeing is these patients are older and they're from more of the rural areas of Tennessee, all of which to me leads to think that the mortality rate will be higher just because of the increased age and comorbidities. Unless we do something to curb transmission now, we will see more people die. And we may see our hospitals hit a capacity that will make it hard for them to take care of other people. In fact, now as we start seeing a new wave of coronavirus, we're also starting to enter flu season, a time which traditionally puts extra strain on the hospital. The combination of flu and coronavirus in our hospitals may be a really bad situation. So do your part, Nashville. Wear your masks, stay apart, and wash your hands. And if you're worried, get tested. Now, I do want to clarify something regarding testing. If you have a close contact with someone that you know has COVID-19, you must self-isolate for 14 days. That doesn't mean you get a test right after exposure. The way this virus works is you may not show positive on a test for up to 14 days. That's why it's so important to self-isolate. That's why Governor Lee is doing that. That's why others who've been exposed to this virus are doing that. And that is why you should know if you've had a close contact and why you should self-isolate. Now, I want to update a little definition of what a close contact is, because just yesterday the CDC updated their definition of a close contact. A close contact, up until yesterday, meant anyone that was exposed to somebody for 15 minutes or longer within 6 feet was a close contact. The CDC has now expanded that definition to mean if you have been close to somebody for a total of 15 minutes within 24 hours, again, within 6 feet of them, you are now a close contact. So that has now broadened the definition of close contacts. This is important to know. You have to stay away if you have a close contact to not pass on this virus. If you're worried about the virus, remember we do have our community assessment centers open 5 days a week from 8 a.m. to 2 p.m. where you can get a free test and you get your results within a day. Nashville, I appreciate everything you've done, and I know that we're hitting a hard time again, but we have been here before and we have overcome this before. So please stay vigilant. I now would like to introduce Ms. Lindsay Smith. Thank you.
Good morning, Nashville. My name is Lindsay Smith, and I'm with Vote Early TN, which is a nonpartisan, first-of-its-kind initiative designed to educate and excite people about early voting. This year, you have the chance to participate with your local organizations, elected officials, sports teams, and more to make sure that your vote is counted. We're currently in the middle of a pandemic, and it is so important that we keep our community safe. With early voting, you can pick the day, you can pick the time, and you can also pick your early voting location of your choosing. It's so important that you know all of your options, and that's why Vote Early TN is here to help you find your options and more. If you have questions or want more information, or if you'd like to adopt a day of early voting, follow us on social media at Vote Early TN. Thank you so much, Nashville, and thank you, Mayor Cooper. And remember to stay safe, mask up, and Vote Early TN.
Thank you, Lindsay. We'll now hear via WebEx Dr. William Schaffner.
Thanks, Brian, and good morning, Mayor Cooper and all my colleagues. It's a pleasure to join you this morning. The subject is masks. So let me be clear. Masks work. They interrupt the spread of infection. They protect others from you. And of course, we know that you can be without symptoms or have only mild symptoms and spread this virus. And they also contribute to protecting you from others. Masks are safe. Masks are cheap, and they're easy to use. Masks are fundamental to reducing the spread of the COVID virus. Yes, masks are a bit weird. They're unsightly. They're unusual. They're somewhat uncomfortable. And yes, they can mess up your hair and your makeup. But let me repeat, masks work and are fundamental to reducing the spread of the COVID virus. Masks should be worn by everyone outside the house unless they're engaged in strenuous physical exercise away from other people. Now, I'm going to sound a little bit testy. That's not usually the way I present myself in public. People say they have COVID fatigue and are tired of wearing masks and are looking for reasons not to wear them. You know, we've talked about this being a war against this virus. Well, let's think back together to a real war, World War II. It went on for 4 years. The war against COVID is not a short-term matter. Back then, there were real sacrifices. Young men went off to war and weren't home for years. Families who remained, my dad was too old to serve, did not have enough gasoline for their cars. There was no recreational use of that automobile. That's a sacrifice. We all had ration cards. There were limits on how much sugar, butter, and other commodities families could have. I remember in my family, there were shortages for times. This went on for years. Those were sacrifices made by the greatest generation. Wearing a mask is not a sacrifice. It's an inconvenience. Well, we're fighting a war now. 220,000 people have died in the United States. Cases are rising again in Nashville and in our state. Wearing a mask is not a sacrifice. It's an inconvenience. Wear your mask. Stop whining. Get with the program. We must make wearing the mask a social norm. This is not a political statement. It's a public health matter. We do this together for each other and for ourselves. That formula worked in World War II. It can work today against the COVID virus. Yes, let's all be clear. The hard truth is that this is going to take months. Let's get with the program. Nashville can show the country how it should be done and can be done. Wear your mask. It's the right thing to do because it's the effective thing to do. Thank you very much.
Thank you, Dr. Schaffner. We'll now begin taking media questions, starting with Dennis Ferrier. Good morning, Dennis.
Hey, good morning. Thank you, Brian. A question for the mayor. You know, considering the recent openness and sharing COVID cluster numbers, I'm wondering if you regret not being more open with Nashville back on July the 2nd with the big shutdown. We've learned your senior advisor, Benjamin Eagles, wrote just 2 hours before the press conference, quote, "We can't say 30 cases. People will not understand the severity and how contact tracing works." I wonder if you now think that was a mistake and it would have been more forthright, maybe a higher road to just say, hey, we know the numbers are low, but here is what we are going to do anyway because.
Well, thank you, Dennis. Well, gee, I don't agree with the premise of your question. I think we've been completely transparent in dealing with a new disease and very forthright. And always the effort to stop super spreading has been foremost in this county's mind. And super spreading, we've always recognized, can happen in different platforms. And people should not be encouraged to strike matches in hay barns. You have to understand that you're in a hay barn in some cases with cases, and that some cases can lead to super spreading. We've always done that. We've done that from the beginning. We want to do that now. And we're happy for people to inspect what goes on all the time. We're transparent and appreciate your question, but I don't agree with it. Thank you.
Thank you. Our next question is from Julia Palazzo with Channel 2. Good morning, Julia.
Morning, Brian. Thank you so much. Mayor Cooper, will you be attending the debate tonight or because of restrictions have other plans? And then if Dr. Caldwell is there, 2 questions for him. The fundraiser that the president is hosting tonight downtown, just wondering what the process of approving the event was. I know the application process you guys have, the mandatory process, what protocols are in place for that event. And we were looking for an update on contact tracing efforts and the investigation into the worship event a couple of weeks ago downtown. Thank you.
Well, thank you, Julia. I'll go first for a moment while Dr. Caldwell gets to the podium. I do expect myself to be at the debate. I was tested and are following the protocols for the bubble around the debate. This is a great moment for Nashville. It's not what we had hoped for, but we need to be resilient and hospitable and show that we are making every effort to have really just a debate that we're on the world stage tonight. I think it's being streamed in 41 countries. Everybody's going to look at Nashville, and then I want them to know that we are a hospitable, welcoming city committed to an important moment in our national discourse.
Good morning, Julia. As for your second question about the contact tracing regarding that religious event in front of the courthouse, there have been no cases that have been tracked to that event at this time. Yes, there is an event for the Republican National Committee happening at a hotel. Just like any other event over 25 that had to be submitted through the event application process that can always be found by anybody who wants to have an event over 25 people anywhere in Davidson County at asafenashville.org. So I have been reviewing the specifics of this event. There's a few different pieces to this event, and I just toured this morning with our Deputy Director, Dr. Stephanie Belli, the site to look to see that they had all their safety protocols in place. There will be actual testing on site for some of the individuals, as well as face masks will be required when not actively eating and drinking. Social distancing is going to be there, and there will be very limited alcohol. So all of the things that we're always concerned about to have safety at events will be there. As well, myself and Dr. Bailey will be there to monitor the event, working with the staff of the hotel. They've been very cooperative and grateful for our involvement. So we're looking for that to be just as safe as the debate itself. Thank you, Julia.
Thank you, Dr. Caldwell. Our next question comes from Nancy Amons with Channel 4. Nancy.
Hi, thank you. I have a series of questions. I hope you're patient with me today. You've already answered the question about the religious gathering. I'm interested in following up on the hospital bed capacity and hearing more from Dr. Jahangir about the 5% in the Nashville hospitals. Is General Hospital going to be ramping up, and what else is involved in the emergency plan? I'd like to ask Dr. Schaffner his thoughts about the vaccine plan that came out yesterday. His thoughts on they want everybody to have the vaccine, whether they've had COVID or not. If you've already had COVID, your immunity doesn't last very long. So why would a vaccine protect you for very long? Thank you.
Thank you, Nancy. I think that Dr. Schaffner has dropped off. Or is he here? Okay, sorry. So we'll start with hospital capacity and Dr. Jahangir.
Sure. So Nancy, thank you for that question. I mean, it is a worrisome number. I know the hospital systems who've signed on to this letter, as well as Nashville General, are working on their own emergency capacity plan and surge capacity planning. I know certain hospitals are starting to double patients in rooms, and that's important. Regarding the alternative care site in Nashville General, you know, that's the State Department of Health runs that site. I've had conversations with leadership at the State Department of Health most recently as yesterday. That will be a place of last resort. if needed. And the hope is by both them and by us that we will turn the tide of what's going on in our city right now, and that we won't hit that moment of last resort. But this is not a joke. This is not a drill. We have to take this seriously, use the most effective tool we have for ourselves right now, and that's the mask. And but yes, all of those plans that we talked about in July are still able to be used now if needed. So hopefully we won't need them. Thank you.
So, good morning, Nancy. Yes, every state health department under the direction of the CDC is working on plans to distribute and implement the vaccine when we hope it becomes available. And the plan that I have seen from the state makes it equitable and very careful and transparent means of distribution. We'll have to do an awful lot of education. You know, many people have expressed the opinion that they're going to be rather reluctant to receive the vaccine when it first arrives. And we're going to have to reach out to make sure that our entire population has the vaccine available to them and gets the information they need and are reassured about the degree of its effectiveness as well as its safety. I'm particularly concerned because the national surveys indicate that populations distinctly affected, disproportionately affected by this virus, people of color, lower socioeconomic status, of ethnicities, these minority populations have expressed a particular reluctance to immediately get in line and roll up their sleeves. I make the point that this is going to take months because the vaccine will become available, we think, in a steady stream over a long period of time. Apropos of the duration of protection, you make a very nice point. We won't know what the duration of protection of that vaccine is once it becomes available for use. The CDC has plans to monitor that across the country, so we will be advised as we go along for exactly how good this vaccine is, how effective it is, and what the duration of protection will be. As they used to say on radio, stay tuned. We'll provide that information as it becomes available. Thank you.
Thank you. Our next question is from Harriet Wallace with Fox 17.
Good morning, everyone. Thanks for taking my questions, and I've got a few. First, this question is for Mayor Cooper. You mentioned concerns with some of the areas, some of the cities within our region not requiring wearing masks. We know that Nashville is a destination area. Is there any plan or consideration in the future maybe to limit some travel between the counties or any restrictions to protect the citizens of Davidson County? My second question is for Dr. Jahangir or Dr. Schaffner. If we could talk a little more about hospitalization. At one point, I know Music City Center was on the table as being used for an overflow hospital. Is that still the case? And can you really paint a picture of just how close we are to maybe needing to activate either of those facilities? And is there any message from any of the leadership up there to our medical personnel that are overwhelmed, who feel that maybe they're out there on their own, not enough is being done to support them and make sure that they can take care of the people who are sick? Thank you.
Well, thank you, Harriet. I'll go first. And your first question on restrictions within the state on things like travel. No, we're in a state, and I don't think you could do it, and we're not going to do it. However, masks are the best tool that we have, and we are for sure going to encourage our region and our state to have higher mask utilization. As Dr. Schaffner says, masks work. We have an effective tool. We need to use that tool. If we use the tool, then that will allow us to recover economically more quickly and get back to normal sooner. So let's just use the tool that we have. Here in Nashville, I think we've shown the value of the city, along with business, requiring masks. Utilization does go up. And to have that same utilization in the region would be the first step in combating the disease and preventing the current surge. Thank you, Harriet.
And Harriet, I'll take the second question. The hospitals, the plan for hospitalizations, the Music City Center currently is not assigned for the alternative care site. It's Nashville General Hospital, which has been built out. I want to, the partnership with the state, Commissioner Piercy, Deputy Commissioner McDonald. They've been extremely great partners with us in making sure those plans are in place. There is there's, if need be, I think there would be other sites, perhaps, but I think more relevant or important to know is the first step is going to be that each hospital systems kind of kicks up their surge planning, and hospitals are doing that. Hospitals are double boarding patients. Hospitals are gearing up their PPE and their staffs and all the things that they were doing back in March, April, and May. So there's a lot of planning that had been done then, that those plans don't just sit on the shelf. I mean, they're available to be put out as needed. And so that, I think, are important things. It's one reason that the hospital systems put out a joint statement to make people recognize, listen, they've done a lot and the state's done a lot to prepare, but at the end of the day, if we don't have to utilize emergency precautions, that's the best way to go. So that's why the hospital systems want to raise their hand and put that warning out there. Now, regarding this support that you're talking about for first responders and healthcare workers, and frankly, all of us, yeah, I think it's an important one. I mean, we're now going on 7 months of a really tasking thing, and when you're in there taking care of patients who have COVID, and I actually just had a patient who I operated on a couple weeks ago. I just got a letter from his wife that he passed away a few days ago. Yeah, it's hard, but I know hospital systems and others have resources available for our healthcare workers and first responders if they need that help. And I think it's important to recognize that it's okay to ask for that help. This is a stressful time, and one can get the stress of the trauma from this. So get help. I know hospital systems have resources. The state has resources. The city has resources. It's important to recognize that. So I appreciate you bringing that question up as well. So thank you.
Our last question is from Brett Kelman with the Tennessean. Good morning, Brett.
Hi, good morning, everyone. I'm going to ask the same question I asked last week with a little bit more context. Obviously, the virus is getting worse in the city by virtually every metric. Last week, I asked the mayor if, considering that, he was thinking about tightening any of the business or gathering restrictions that exist in the city and used to be tighter. At the time, Mayor Cooper said he was not. But a week has passed and things have gotten worse. And I'm curious if those options are back on the table.
Well, thank you, Brett, and the Tennessean for that question. Things have gotten worse. But at the same time, we're not using our best tool, which is masks, effectively in our region or in our state. I want to thank Williamson County's announcement today that they're going to go back to a mask order, and I hope other counties do the same. We in Nashville have done a great job in limiting the surge here, but we can't control it in the rest of the state. And so we need, I think, a state mask mandate. We've said this from the beginning. And we need certainly our regional counties to follow what we have shown is effective. We have more than 100,000 people come into our county every day, and that many go back every day. We're not an island. We're not isolated. We've been effective in what we do here, but we need to be more effective as a region. Clearly, the greatest spread is in rural areas, not just in Tennessee, but in the entire country, and limiting the spread in those areas is as important as limiting the spread in metro areas. Now, we always were headed to have more cases here because we are denser, we live together, we have nursing homes and prisons and hospitals. We have every condition to have the worst outbreak here. The fact that we were able to push us way down on that list does show the effectiveness of masks. So I think the takeaway right now is we need to get back to a high level of compliance to masks with everybody in the state. And that's, as Dr. Schaffner confirms, they work. We can get them to work, we can get them to save lives, we can get them to get our economy restarted, but we have to do it.
Those are all the questions we have this morning. I'd like to thank Lindsay Smith and Dr. Schaffner for joining us today. As always, we're grateful to Amy Lankheit and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next Metro COVID-19 press briefing will air on Thursday, November 5th at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.